Good afternoon. On behalf of Peoria County Board Chairman Andrew Rand, Tazewell County Board Chairman Dave Zimmerman, and Woodford County Board Chairman John Krug, I would like to thank everyone for listening in on today's Peoria City County Health Department briefing. In our continuing efforts to get all of the current and relevant information that we have out as quickly as possible, over the last couple of weeks we may have unintentionally sugar-coated some of the information, so maybe it wasn't quite as difficult to digest. I think if we're honest with ourselves, up until now, most of the changes we've had to make on our daily lives have been probably at least a little bit uncomfortable. And as the days go by, the uncomfortable is giving way to distressing, and in some cases, painful, both physically and mentally. Our community has been and continues to do a very good job of planning for different scenarios and managing the tasks at hand. We can't thank our emergency responders and health department leaders enough for all that planning. But I'm not going to sugarcoat things now, so make no mistake, our toughest days are ahead. If we all do our part to follow social distancing and strictly minimize movement throughout the community, unless it's absolutely necessary, the pain may not be as bad. Don't go to the grocery store or the home improvement store every other day just to get out of the house. Go as infrequently as possible, and when you go to the store, get what you need for a week or more. Young people, you are not immune to COVID-19. Your body might be stronger, but you can be infected with it, and you can still carry and transmit COVID to your family, to your friends, and other people in the community. Every one of us owes it to each other to do everything within our power to reduce the spread of COVID-19. We must relieve as much pressure as possible from our frontline healthcare professionals. The pressure on them is enormous, and it's growing every day. Each selfish act of noncompliance with our public safety measures puts their lives and everyone that you come into contact with at risk. So going forward, just do it for everyone's safety and put us on the other side of this terrible pandemic. Now I'd like to introduce Monica Hendrickson from the Health Department.
Thank you, Mayor Artis. Good afternoon. Reporting on today's counts to date for the Tri-County area. We have a total of 21 confirmed cases. This is an increase of 4 cases from yesterday. Peoria now sits at 9 cases, with an additional 2 cases for residents outside of our county but are currently being processed and investigated by our staff. Which would give our total to be 11, which is what is being represented on the IDPH website. Tazewell County has 6 cases. The 2 additional cases in Tazewell County are related to travel, and 1 identified through the community-based testing clinic done in McLean County. And Woodford County is now at 6, and that is related to a contact of a known positive. Again, we are at 21 cases, 9 in Peoria, with 2 additional ones related to residents outside of our county, but are currently under our investigation, 6 for Tazewell and 6 for Woodford. Today marks actually the first day that the local jurisdictions are receiving the test results associated for the community-based testing clinics that were held in McLean County last weekend. With that, we do expect numbers to roll in, both the positives as well as negatives, in the days to come. Our immediate priority is to focus on those positives, identify them, and then begin the contact tracing. Previously, a lot of our focus has been on contact tracing based on when symptoms started and then moving forward in time. We will also be now looking at 2 days or 48 hours prior to when symptoms started based on new guidance from the CDC, or the Centers for Disease Control and Prevention, as well as the Illinois Department of Public Health, recognizing that during that 2-day period of it being asymptomatic, there's a lot of transition still going on. In terms of our hospital data, reporting for the 4 hospitals of Unity Point Health Methodist, Proctor, Pekin, and OSF St. Francis Medical Center, people under investigation currently in the ICU is at 9. Confirmed cases of COVID in the ICU is at 4. Suspect or confirmed COVID cases are at 16 for the previous 24 hours, and 24 specimens were collected in the past 24 hours by those 4 hospitals. To discuss further about the medical and hospital's response, I'd like to introduce Jen Hopwood, who is the Chief Nursing Officer for OSF St. Francis Medical Center.
Thank you, Monica. I think there's been a lot of interest regarding how prepared our community is if we do see a significant number of patients needing to be hospitalized. And I'd just like to take a little bit of time to share with you what OSF Health Care St. Francis Medical Center has been doing to prepare. We are normally a 649-bed medical center. 120 adult ICU patients are able to be served on a normal basis. However, we've determined that we can increase our capacity to be able to serve 1,000 patients and increase our ICU capabilities up to 200 patients. Part of that is due to being able to utilize spaces outside of the traditional ICU setting, areas like our procedural areas, recovery rooms, pre-post areas, for us to be able to monitor ICU patients in. We've also been working with our staff to be able to redeploy them from areas where they're seeing low activity now because we've canceled non-essential surgeries and procedures, and training them to be able to partner with nurses who are working in those inpatient settings to be able to care for that influx of patients. So those nurses and other clinicians have been getting training in our electronic medical record to be able to document and review the records, have been going through skills and competency validations to be able to partner again with those core staff from that area. We've also been doing a lot of work around changing standard operating procedures, caring for a COVID patient in settings like our labor and delivery, our cath lab, our interventional radiology, surgical areas. All requires coordination with our medical providers and the nursing care teams and other ancillary staff to make sure that it's done safely, based on the newest literature that's out there, and done in a way that is making sure that we're providing high quality care to the COVID suspect and COVID positive patients, but also the other patients in our facility and also our staff as well, making sure that they're well protected. We have been doing quite a few in situ simulations for high risk procedures, like what happens during a time when a person would stop breathing and what a code blue looks like when we have to work in those isolation precautions. We've also done some work within our emergency department to better serve an influx of patients. Our volumes are down overall within our emergency department, and I think a lot of that is due to unless you're sick and need to come to the emergency department, it's not the place to be right now. So we do want patients who have emergent needs to come there, but the messaging has gotten out to our community, and we thank you for that. So some of the things that we've done within our emergency department is you'll be greeted right away and triaged to either a respiratory illness area or a non-respiratory illness area. If you're a lower acuity patient, we do that rapid medical screening evaluation and send you home for follow-up with your physicians. And then we will, of course, see those patients with the emergent needs, as we always do. We have set a tent up in our emergency department parking lot. That tent is not in operations, but the tent would serve the purpose of being able to see those lower acuity patients coming in with respiratory illness if we started to see an influx. We're ready to stand that up as soon as that influx starts. Again, that's not here. But we have done the planning and necessary steps to make sure we're able to serve our community if that time does come.
So we're going to do something a little bit slightly different. We are going to open up to questions for Jen, as well as I did want to give a little bit of clarification from yesterday's briefing. I know there were some questions about modeling and understanding kind of what our cases could possibly be here locally. Dr. Stoner was referencing a March 18th, 2020 MMWR, which stands for Mortality and Morbidity Weekly Report from the Centers of Disease Control and Prevention. This report looked at cases of 2,449 between February 12th and March 16th throughout the United States, and based on age ranges, determining how many were hospitalized, ICU admissions, and case fatality. Most of the modeling is done that we are seeing is at a state level, some suggesting that Illinois is still having the peak for weeks to come. But using the data from the MMWR, we did use census data, which again shows the importance of conducting your census, to understand what those numbers would look like here locally. The ranges are rather wide, anything from either 10.4% to 27.3% of those individuals over the age of 85 having case fatality. But knowing our Tri-County's population, to give you a rough understanding of that, someone in their between ages 65 to 74, we can see anywhere from 9,000 to 14,000 hospitalizations over a month if our numbers were to mimic that from the MMWR. Having said that, and speaking on what Mayor Ardis discussed about the fact that we should be serious and really consider this, no age group is immune to this. We can see individuals ages 20 to 44 having a similar number of hospitalizations, anywhere from 14,000 to 21,000, based on that kind of response. But recognizing the fact that this MMW was published during a period when we were not doing interventions such as stay at home, such as limiting non-essential travel. So with that, we don't want these numbers to come in place. The plans that OSF and UniPoint are doing are ones that we don't necessarily have to use. Recognizing that we are planning for the future, the best way we can prevent this from happening or either decreasing these values is to adhere to those types of policies. So we'd open up to any questions in regards to the medical side.
Monica, are hospitals prepared for overflow at this time? I know the Civic Center is a possible overflow location. PPE, is there enough supplies? Are nurses having to ration supplies?
I can talk in generalize that both hospital systems have worked on surge capacity, so going above their numbers. That kind of explains to why, capacity of beds, looking at their staffing models, as well as alternate care, so necessarily maybe housing certain patients in different locations. Even with PPE, they're looking at how they can conserve and expend those in a proper manner, and so I'll leave it to Jen to talk a little bit more about OSF.
We have looked at alternative sites of care and have identified a number within our community. It is very difficult to replicate hospital operations at a completely different site. So our goal first would be to maximize our space and the resources that we have within our campus downtown before we look to those alternative sites. As far as PPE, we have an adequate supply. We have been following the CDC's recommendations for how to conserve, and that has extended our supply beyond even what we do have. And at this time, there's no risk for our staff not having the appropriate PPE.
What's our supply in terms of, for OSF that you can speak to in terms of ventilators, since we know that this is something often needed?
So because we have a large number of ICU beds, we do have the ventilator capability to support that. We have 130 vents. Of those that are in use today, I think we were using 38, so that leaves a little over 90 available to us. We also have, though, contingency plans of what if that 130 is not enough. The ventilators that we do have are able to do multi-patient modalities, not ideal and would be a last resort. We could also look to utilizing our anesthesia machines for ventilation, and we have a number of those because our case volume is down that could be used as well. I don't anticipate us having an issue with ventilator resources.
And you mentioned, nurses from different departments being trained in new things. So then, kind of, how are you deciding who gets, kind of trained in a new thing? And then, kind of, a second part to that, for nurses that may still be, part-time in their old department and then part-time and working kind of in COVID, how are we making sure that the patients that they may be treating in that other department stay safe?
Yeah. So, extremely complex situation. I think it's important to remember that all nurses possess the same basic skill set of nursing assessment, the ability to administer medications, the ability to document in a medical record. It's really where we would look to prioritizing those people who have experience in particular settings first. So if I've had a number of people who have left the emergency department in recent years, it would make sense for me to send them back to that location first. But we've developed a team-based nursing model where we would really partner a core person from that work unit where those patients are housed, partner them with another nurse that has the ability to assess, administer medications, notify doctors, accept orders, and do a lot of the other basic skills. So it's really been focused more on task and competency checkoff.
Is there a fear of low oxygen tanks or supplies for others with respiratory issues or respiratory conditions?
I think that's a really great question, and it's something that we've looked into from our infrastructure. We want to make sure that with the increased amount of ICU patients that would be expected if we saw an influx of patients, that our O2 reserve would be able to support that. The other piece of that is our medical air, because that's what powers our ventilators, and we have a sufficient supply to be able to accommodate well over what we would need for those 1,000 beds if every person required a ventilator.
You talked about how obviously, we've all talked about, obviously, our doctors, nurses on the front lines of this. What are steps that OSF is taking to make sure that they're staying healthy, not only physically, but mentally?
Work-life balance is important. Our volumes are down right now because our cases are canceled and we haven't seen the influx of patients. And so, it's really using this time to make sure that they're well-trained, well-informed, that we're having conversations with them, and that they are making sure that they're maintaining that work-life balance at home. Their jobs are tough.
Jen or Monica, do you know if the governor was talking about Peoria when he talked about additional alternative hospital sites in central Illinois?
During the governor's announcement today, he had mentioned alternative hospital sites throughout the communities. I know our community is being assessed, largely because we have a strong healthcare community as well as space and resources, but there are various communities that are being assessed based on just population size and those added aspects around them that can support operating a function like this, ease and egress into that community as well. But we have not been notified directly if Peoria or Tazewell or Woodford are going to be set up for those type of sites.
That MMWC, do I have that acronym right?
MMWR.
MMWR. How often does that come out? That's a weekly report, you said?
It is a weekly report from the CDC. The topics vary, and so the one I brought up specifically was looking at the March 18th MMWR that did a kind of a historical review of the 1 month period of cases in the United States, excluding those associated with cruise ships, and just to understand what that type of population distribution for, again, hospitalizations, ICUs, and fatality look like.
So since March 18th, there's been a lot of additional interventions put in place, stay-at-home orders across the country, so on and so forth. I mean, has there been a revised version that's gone out that shows what the current projections are now? I mean, have they gone down significantly?
To my knowledge, there has not been a revised MMWR on those rates. However, if one were to go out to kind of do a comparison, it would come out here in mid-April. And so hopefully we would see something here in the next few weeks that can demonstrate how some of the states that took on a very active and aggressive role in controlling or flattening that curve and seeing what those look like. At the same time, it's going to be also interesting because we did see as a country the last 2 weeks of March really seen uptake in cases nationwide. And so it's going to be a balancing of understanding that. But again, a lot of that's really focused on just recognizing the fact that there is vulnerability on all populations. There is no group that is going to see this worse than another, and just because you might think that you're young and healthy, you're not necessarily immune to this.
One more question for Jen. We've heard the governor talk about people of all different ages, from students to people who have retired, rejoining, the healthcare force to help with this. Are we seeing a lot of that in our local area that you know of?
I think right now we have enough reserve within our health system at OSF that we have not had to look to those individuals. I think that the areas probably that need it more in our state are in the Chicagoland areas.
Thank you, Jen. We're going to go ahead and move on to Chief Lorne Marion, the Chief of Police for the City of Peoria, as well as, I believe, Sheriff Asbell? Oh, he is here too to discuss, again, some of that as we now move into an extended order of stay in place. What does that mean in terms of our community, and how as a community we can respond?
Good afternoon. I want to talk a little bit about social gatherings. With the nice weather out, we've had an increase in calls of people gathering in large groups. The CDC defines a gathering as 10 or more people. We know that's tempting for people to want to go outside and do things like play basketball and football, but we're asking you to make the choices that are good for the community and for each other. The goal for law enforcement is compliance. We don't want to take enforcement action, but we will if we must. I've been asked what the enforcement action looks like, and I'll explain that a little bit. As I just mentioned, we will attempt to gain compliance and simply ask the groups to disperse. If the groups refuses to disperse, at a minimum, we'll document the incident and forward the report to the state's attorney's office for a review of charges. If we have repeat offenders or serious violators, there's a potential that they'd be arrested for charges such as disorderly conduct, obstructing, or reckless conduct. The sheriff put it well yesterday when he said that people are putting lives at risk, including the lives of first responders and healthcare workers. Heard a few hours ago that a 21-year veteran of the Chicago Police Department has died from COVID-19. My heartfelt condolences go out to the officer's family and the Chicago Police Department for their loss. I want to reiterate a couple things that the mayor said on Tuesday. If you go out for necessities, use good sense. Maintain 6 feet from shoppers and staff, and stay at home if you're sick. You may ask, how can you help? Do your part in with the order and comply. It's very simple. Just comply with the order. If you see a gathering of people, please call the non-emergency number for the police department, 673-4521. Again, the CDC defines a group as 10 or more. When practical, the police department will dispatch an officer will respond and address the group. Just remember, we're in this fight together, and continue to look out for each other. Thank you.
We'll open up to questions for both the chief as well as the sheriff.
Question for the chief and the sheriff. They could both take a crack at it if they'd like. It's something you're fortunately seeing a lot going around on the internet. And I believe we had a case in Peoria today of kind of an internet prank of people going to a grocery store and coughing either on people or near the food. Talk about how there are some consequences to actions like this, that it's not a joke.
Absolutely. I'm glad you brought that up. We did have a case yesterday afternoon where an individual was at Aldi on University and thought it would be funny to cough on an individual and act like they had the virus, and may have even mentioned that they had the virus. That is taken very seriously. The officers that responded did a good job and reported the incident, and then the case went forward to the state's attorney. I personally contacted the state's attorney for a review of charges as well, and it appears at this time that there will be additional charges coming forward. So in the future, when we have those cases, we will address them quickly and take them very serious.
And believe it or not, people are taking advantage of other people's suffering. What scams have you heard of, if any at all, besides the expedited receipt of the stimulus check? And how can you tell neighbors to make, or how can you, what can you tell neighbors to make sure that they are not victims of those scams, whether they're online?
The main thing is, if it doesn't feel right, it's probably not right. So if you get a call and people are representing themselves as an organization or something, before you move forward and make any type of donation or anything, contact that organization and verify that they are doing that.
Even though some people, you know, you say if it doesn't feel right, it's probably not right. Some people maybe go. Some people may believe that it is right. So what about those people who think that this is actually, you know, a verified site or a certified site?
I would caution everyone that if they're receiving calls, that to be suspicious of that, because you know right now, if an organization is reaching out, if you get those calls, call the organizations and verify it before you start donating money.
Question for both of you as well, you know, as obviously very essential services, what are you doing in terms of, you know, unfortunately sometimes the nature of your work involves, you know, officers or, you know, deputies interacting in close quarters, kind of what are you doing to help keep them safe when there might be, you know, in close interaction with one another?
Sure. So early on, I'll speak for the Peoria Police Department, obviously. Early on, when the virus started taking some traction, we started off with the awareness level, and then we moved to acquiring additional PPE, personal protective equipment, making sure that the officers were equipped for that. And then we started looking at how can we reduce interaction between the public and the officers. So for an example, streamlining services such as taking the reports over the phone for previous incidents. So instead of sending an officer to a house for an earlier theft where there's no suspect, we will now take those reports over the phone. And we've also made adjustments at our roll calls. So instead of the officers coming in and sitting in a room of 20 people during roll call, they come in, they get their keys for their vehicle, and they spend the 15 minutes disinfecting the vehicle prior to going out on the street, and they're not having the interaction of sitting in the same room together. So that's just a few things that we're doing at the Peoria Police Department. If Sheriff, if you want to mention anything on your side.
You're doing really good. Chief, unfortunately, we are seeing increases in domestic violence. Do you expect those numbers to keep rising?
I do, and like the sheriff had said before, that he's seeing a larger number of domestic violence cases at the jail of bookings, and we're seeing that. I do expect it to increase. And another thing that we are keeping an eye on are the suicides. So we want to make sure that people are out there, if they're in times of crisis, that they're reaching out to get assistance for that as well.
So Holy Week is coming up, and I know you already talked about consequences of those not following the orders, but tell us again how you will be cracking down on churches who aren't following the stay-at-home order during this time.
I'll address this one, Beans. We had a situation last night that I think that's already out there with dealing with the church. This was fortunately just addressed by the Dr. Ezekiel in the governor's address as well, that there's not going to be church services. We're asking everyone to go to a virtual or an online platform. We've been getting a lot of requests this week and questions from churches just for that reason. Easter's coming up. They're asking if they can do a drive-up type service where everyone can come in their cars and be in the parking lot. And our direction is no, this is against the order. This isn't labeled as an essential business. In my 25 years, I never thought we'd be sitting up here and having these conversations. I never thought that we would have to be enforcing these types of rules, but they're necessary right now. Public safety and public health have one mission right now, and that's to prevent the spread and to save lives. And we have to take these drastic measures. We have to do these things. This is going to hurt a lot of people, especially on a holy day. It's going to hurt so many different people. But we're just asking them to follow this order. If it's not essential, have a reason why you have to leave the house, and find an alternative way to worship.
Now, a pastor in Florida was actually arrested for defying the order and having church and telling his members to come on in. Yeah. Can that happen to these pastors here?
Yeah, well, it's just like like Chief Marion just said. I mean, all these situations are a case-by-case basis. The totality of circumstances, we're going to look at the situations, but if they're going to practice these behaviors and bring people into a building where it's already been said, no, don't do that, you're taking a lot of risk. Whether it's criminal, it could be civil liability as well if someone falls ill and they can direct it to that instance there. It's the same message we have for employers. They still need to have even if you're defined as an essential workplace, you have to take the precautions and have a safe working environment for the employees. It's just that continual message. So I know this is hard. This is really hard for so many people in our community, especially at this time where they need to be around. They have to have fellowship. They need that. We're just having this message so everyone's aware this isn't going to be allowed to have these drive-up services.
I have a question, I'm not sure for who, it's regarding playgrounds, parks. So if you all don't know, or I'm sure you all know that the rings were taken off of the basketball hoops, or the basketball rings were taken down. The parks, so I've been told from Peoria Park District's president, they're still open, except you're not supposed to use the amenities. Now the playscapes are just there. There's nothing, no caution tape surrounding all of them. Is that something that needs to happen to really let people know, hey, you can't use this playscape? Because people are still using the playscapes and the amenities at these parks.
My answer is going to start with parents on this one. We need parents to be part of the solution, not part of the problem, and taking responsibility for their children and telling them to have safe behaviors. Again, I never thought we'd be having these conversations. These are activities we usually push for our children to be outside and playing and doing things like this, but right now we cannot do that. We've been getting these calls where there's groups of kids, like Chief said, they believe it's summer break, and they're going out and they're playing the games, and it's putting a lot of unnecessary risk to first responders, to healthcare workers, to all these different individuals. So I truly think this starts at home. We have to have these conversations, and we need our parents to really step up right now and be accountable. Thank you.
You had a question for the mayor? And also to address your question as well, the Park District does have signage on all of their park equipment, asking individuals and reminding them that this is temporary closed, and hopefully to stay as temporary, because we do hope that we can come back to the day where we all get to play basketball and use our play places and our equipment, but there is signage on all of their parks around their equipment.
Not sure if you would have an answer to this, but we had a viewer ask a question that I thought was, pretty worth asking. Wondering if local governments know if they're going to grant the extension of the first installment of property taxes?
I don't have the answer to that.
Mayor, a lot of people still are not taking this situation seriously. With emergency powers, have you considered putting a curfew out or anything like that?
We have not talked specifically about a curfew. From our law enforcement officials, we're not seeing a large number of people that are not abiding by the rules. So we're trying to handle it on a case-by-case basis at this point. Okay.
Kind of a follow-up to the playground thing, but I know the last time you spoke about, wanting our local businesses and stuff to kind of put policies in place to keep themselves and visitors, their patrons safe. We've had people call us saying that when they go to, say, a restaurant for carry-out and they enter a lobby of a restaurant, there's, 20 people in the lobby, which obviously is kind of
Right.
lessening kind of the point. Kind of what would your call be to business owners to, obviously it's a hard time and they are struggling, but that we have to kind of adhere by these rules?
Yeah, I think it's a continued reinforcement of a lot of this responsibility falls on each one of us individually, but to the extent that businesses can try to regulate that distancing and try to keep people farther apart. We could use the help, but understanding they're on bare bones staff, that's hard too. So I think that we should put the majority of this effort on each one of us to understand. If you walk into an area and there's more than a couple people, then you just wait. Why would you walk into a confined space with a lot of people under the circumstances? It doesn't make any sense to me.
Okay, everyone, thank you again, and we will see you guys again at 3:30 tomorrow.
One more question.
Oh, yes.
Sorry. There have been reports that a dog in Hong Kong died of COVID-19. There have also been experts who say that this isn't particularly true and that this dog was not infected with COVID-19, whether that be from a human. What can you say to people here if they've seen this report about dogs and if they can transmit or if they can be given COVID-19?
So I think your question is specifically about information that people are seeing in terms of animals. I would think this is a general, just kind of a good guidance. There's a lot of information out there from lots of sources. Make sure that you're going to reputable sources to get that information. The Centers for Disease Control and Prevention, the World Health Organization, or WHO, as well as our Illinois Department of Public Health, and of course the Peoria City County Health Department. Make sure you're double checking and getting that from a healthcare provider, a veterinarian, or again, someone that is a respected source in this and not necessarily to those type of online or various forums.
Would you say that this isn't true, though, that you can't transmit or get COVID-19 from an animal?
The information we have right now from the Centers for Disease Control and Prevention is that pets are not carriers of this. Thank you.